My name is Danica Rush, and I'm a nursing student at Ryerson University. And I'm here today as a student and as a future nurse to stand up and to say no to privatization. I say no because I cannot afford to make a choice between my education and my health. I say no because I don't want to walk past people on the streets who have been denied their fundamental rights to health care as I go to work for a private hospital. I say no to privatization because I grew up in a Canada that values patients before profits, equality and human rights. And this is the Canada that I want to welcome others to, that I want to work for, and this is the Canada that I want to pass on. My name is Danica, and I'm here today to advocate with the students for Medicare, for my patients, and for my profession when I stand up and I say no to privatization.
You cannot run the healthcare system like a business. You cannot let money drive the system. What needs to drive the system is the needs of the people. Money drives the system. Money will cause more expense. And that's what's happened. Money is the problem. It's causing the expense. Not the care at the bedside, not the needs of the patient. Put the needs of the patient and the healthcare system first, and the rest will follow. You will not get readmissions to the hospital if you do that. You will not waste money if you do that. That's the problem. The money's being wasted. There's plenty of money in the system. It's not being spent correctly. That's the problem. Back down. McKinsey must listen and must back down. This is not right. You don't make money on other people's
Introducing Sid Ryan, who's the president of PV Ontario, and one of the
sold the bill of goods in the last election. We were told that the Liberals would stand up to protect the healthcare system in our province. Well, let me tell you how they protected that healthcare system. In the Hamilton Health Sciences today, they're closing down their fertility clinic. In St. Joe's in Hamilton, they're contracting out cleaning jobs. In Niagara region, they're closing down the ERs. In Kingston, they turned around and they took over the hospital because the administration refused to make the cuts that they wanted to make.
of the Ontario Health Coalition and the local coalitions across this province show the fact that people in every village, town and city want to maintain our public health care system. But the role of individuals is also very, very important, as many of you know. And I think over the last number of years, our next speaker, Natalie Mera of the Ontario Health Coalition, has been absolutely wonderful in the way she has been able to organize, mobilize, and push us forward in this movement. So please welcome Natalie.
Okay, so just before we march at the end, if you can remember this, I'm going to yell, listen up, and you're going to yell, who? McGinty, right? And then let's make a lot of noise when we get on this march, because today, the point of today is this. We are joining with 5 communities across Ontario. Today, at this time, they're protesting in Windsor, they're protesting in Kingston, they're protesting in Sudbury, and they're protesting in Thunder Bay. Like you, have bussed in from their towns where their emergency rooms are being closed down, where they're moving birthing out of town, where they're moving the mental health beds out of town, where they're forcing patients to drive further and further for services. And this is critically important because if we join up every small town and large town in Ontario that's facing a hospital cut, there will be no choice but McGinty has to listen. So far, we're facing the biggest round of hospital cuts that we have seen since the mid-1990s, the biggest round of hospital cuts that we've seen in a decade. And the Premier has yet to even comment on it publicly in the media. There has been no response from any politician in this government about the cuts to our local health care service. Make McGinty answer for this. No more silence. We don't care about the LHINs. You appointed them. You answer for our hospital cuts. You answer for the privatization that you campaigned against just months ago in the last provincial election.
The marshals are wearing orange vests, so please follow them out to the bus.
As usual, there's plenty of police around. Here they come.